For this assessment, we're going to test Matt's neurologic system. First thing we're going to do is assess and make sure that the person is alert and oriented ×4, alert and oriented to person, place, time, and situation, and also making sure that their cognition is appropriate, appropriate facial expressions, attitude, thought process, cognition, all that goes hand in hand. So please state your name.
Matthew.
And where are we at?
Your house.
What time is it?
Around 9.
Okay. And what are we doing? What am I doing?
Your assessment.
Good. So with that being said, we can move on to the cranial nerves. Cranial nerve number 1 is the olfactory nerve. With this, we can have the patient close their eyes and cover one nostril and identify the scent that is in front of them. All right. What do you smell?
Garlic.
All right. Do you smell it on the opposite nose?
Mm-hmm.
Oh, man, that's potent.
Oh, yeah.
So he passes cranial nerve 1. Cranial nerve number 2 is the optic nerve. We could use the ophthalmoscope to see in the back of the optic nerve and assess the disc and the sensory reactivity to the light. However, we've got the Snellen chart on my phone. So please cover your left eye. And what is that? Line 4.
Line 4, LPED.
Good. Now with your opposite eye, tell me what line 5 says.
PECFD.
Good. So cranial nerve number 2 is passed. Cranial nerve number 3, 4, and 6 all go hand in hand. They assess the 6 cardinal signs of gaze. You want to make sure there's no ptosis, no drooping, making sure that the eyes move correctly together, symmetrically, and also making sure that there's no visual field loss. We'll assess that.
1.
Yeah.
1.
Good. Keep looking at my nose. Good.
2.
Good. Following my finger, making sure up, down, and the stigmatism. Okay, good. All right, so he passes those 3. Moving backwards to cranial nerve number 5 is the trigeminal nerve. With trigeminal nerve, we want to have a patient close their eyes and identify whether or not they feel the same sensation on both sides. This is one of the nerves that also has a motor function, which we'll get into. So close your eyes and feel that. Okay. Is that sharp or dull?
Yeah, it was sharp.
Okay. What about this?
Yeah.
And they both feel the same?
Yeah.
Okay. Now I'll go ahead and have you clench your teeth and move your jaw left and right. No crepitus, no cracking, no numbness. So he's able to do that. Everything is intact. He passes. Moving on to the facial nerve, cranial nerve number 7. We test this by seeing the patient smile. Smile, smile, smile. Good. Okay. Blow your cheeks up. Good. So he passes that. Moving forward, we now want to do the acoustic, which is cranial nerve number 8. So we can do this with the pitch and fork, or we can whisper things in the ear. So what am I whispering?
Go Tigers. Happy Easter.
Good. So he passes that, and moving forward, the cranial nerve number 9 is the glossopharyngeal. The way we can do the glossopharyngeal is having the patient swallow something and also say ah. So before you drink though, go ahead and stick your tongue out and say ah. And so we want to make sure that there's no deviation, making sure that the uvula is symmetrical. If that looks good, then we can move on, which is going to lead us to cranial nerve number 10, which is the vagus nerve. And this is the one where patients are bearing down and may pass out due to this cranial nerve running along the same lines as the jugular. So go ahead and swallow some water so you can test your reflex. And so with the vagus nerve, it's basically testing the swallowing and the gag reflex. We could also assess this if we had a tongue depressor, which we don't. So he swallows appropriately, he's not choking, no drooling, and he passes. Moving forward now to the spinal accessory, cranial nerve number 11. It's basically a shoulder shrug. Go ahead and shrug up, shrug, shrug, shrug. Good. We want to look for symmetry. We want to make sure it's even on both sides. And lastly, the hypoglossal We want to make sure that there's no drooping of the tongue. So this one also goes hand in hand with cranial nerve number 9 with the tongue. And we want to make sure that there's no lagging, no dragging, and then also making sure that there's no drooling. So stick your tongue out and move it side to side, left and right. Perfect, so he passes. After we assess the cranial nerves, we now want to move forward to the deep tendon reflexes and also the motor function. Motor function we can assess by the way the patient walks, if there's any staggering gait, how they're ambulating, the tone and the strength, and then whether or not there's normal balance. So we can begin that assessment now.